is Vicky. I'm going to be your nurse for the day.
Okay.
Could you state your name and your date of birth for me?
Marissa Guidry, 2696.
Okay. So today we're going to look at your abdomen, your liver, your spleen, and also your neurological system and your musculoskeletal.
Okay.
So we're going to start with your abdomen. I just need you to lay flat on your back. First thing I'm going to look at is your contour, just to see if it's flat or rounded, which is pretty flat. Okay. Alright, now the next thing I'm going to look at is I'm going to listen to your bowel sounds and your vascular sounds. I'm going to listen in all 4 quadrants. Make sure your bowels are active. Okay, everything sounds good there. Now I'm going to listen to your aorta and your renal artery. Your iliac arteries. And your femoral arteries. Okay, everything sounds good there. Next thing we're going to do is do a general percussion over your 4 quadrants. And I'm going to go in a clockwise motion. Okay. And now if you could sit up for me and face that way, I'm going to percuss your kidney. I'm going to place my hand right over your kidney. Using my ulna, I'm going to do a thump, and you tell me if you feel any pain.
No.
Okay. And now you can lay on your back again. And we're going to percuss over your liver and your spleen now. Listen over your liver and your spleen. Okay. And now I'm going to palpate your kidney, your liver, your spleen, and your aorta. So we'll start with your kidney. So sit back up for me. Okay. Just going to feel right here. On each side. Do you feel any pain? Okay. And lay back down for me. Next, we're going to do your liver. And we're going to check for Murphy's sign. As I palpate, just take a deep breath for me. Do you have any pain? Okay, now I'm going to check your spleen. Any pain there? All right, next is your aorta. Okay. And next, I'm going to check your femoral pulses and your inguinal lymph nodes. So, femoral pulses. And your inguinal lymph nodes. Okay, everything seems pretty good. And now we're going to do the ileopsias test. Alright, so if you could raise your leg for me. And this is checking for appendicitis. I'm going to internal rotate and external rotate. Are you experiencing any pain? Alright, good deal. Okay, next we're going to move on to your musculoskeletal. So if you could sit back up for me. We're going to start at your lower extremities. So stand up. We're going to make sure that your legs are symmetrical. And your hair on your legs, if it's evenly distributed. Okay. And now, let's see. We're going to check your pulses, so you can lay back down for me. Your femoral pulses again. Okay. Popliteal pulse. then your dorsalis pedis. Okay, and also your posterior tibial. Alright, everything's good there. And next, we're going to do range of motion with your lower extremities, okay? So what I'm going to have you do is raise your right leg all the way with your knee extended. Okay, now raise your left leg all the way. Alright, now this time put your knee to your chest for both legs. Okay, and now I just need you to push with your foot. And again. Alright, good deal. And now we're going to move on to your upper extremities. So sit up for me. Alright. Actually, you can stand up because what we're going to do, I'm just going to show you, okay?
Okay.
I just need you to put your arms behind your back like this. And just go in this motion back and forth. Okay? And now your elbows. Okay? And now I'm going to have you push down on my hands. And push up. And squeeze. Alright. And you can just do your hands like this for me. Okay. And move your fingers out. Okay. Good. Alright. You can have a seat now. Now we're going to check your patellar reflex, which is your knee reflex. And check both of these. Alright, good deal. Okay, and now, second to last thing we're going to do is the Romberg's test. So stand up for me. Okay, close your eyes. Alright, so we're just testing to make sure that you have balance and posture for 20 seconds. Okay, good deal. And last thing we're going to check is your spine. So turn around for me. I'm going to move your hair out the way. Make sure everything is even and straight. And I'm going to check your spinous processes. Make sure there's no tenderness or pain. And please let me know if there is. None?
Nothing.
Okay. And let's see. Okay, I think we covered everything. So thank you for your time.
Thank you.
Okay, so starting off with this patient with the abdomen. Her contour was flat and her abdomen was equal bilaterally with no bulges or visible masses noted. There was no striae or scars present to her abdomen. Her umbilicus was midline with no redness. And because this patient is thin, her respiratory movement and her peristalsis was visible. Her bowel sounds were active in all four quadrants on auscultation, and there was no vascular sounds of bruits heard to any of the arteries. There was no abnormal fluid or masses during percussion of the quadrants, and there was no dullness noted to the quadrants during light percussion. Also, during palpation of the liver, spleen, kidneys, aorta, femoral pulses, and inguinal lymph nodes, there was no masses or tenderness noted. And there was no tenderness or masses noted to percussion. And Murphy's sign was normal. And ileopsis was normal. There was no appendicitis. And for the lower extremities, her legs were equal bilaterally. Her skin was clear with no bruises or marks. Her hair was equally distributed to the legs. Her lower extremity pulses were equal and bounding. Her range of motion was intact and strength was equal on both sides. And for her upper extremities, range of motion intact as well and strength equal to both sides. The Romberg test was normal. Her patellar reflex, the left and right sides were equal, scaling at 2+ on the point scale. And the scoliosis screen, the spine was straight with no tenderness noted on palpation of the spinous processes. Thank you.